Hello, this is Dr. Drew Moffitt at Arizona Reproductive Medicine Specialist, and this is another edition of our Facebook Live series. You can always reach us at our website, which is arizonafertility.com, or you can call our office at 602-343-2767. Today's installment is going to be about the topic of in vitro fertilization, or IVF, versus a tubal anastomosis. So the situation arises not uncommonly that I see a patient comes in who has had a tubal ligation done in the past and now desires to have children. Commonly that's because they are in a new relationship, and in that new relationship they want to have a child together. So what the question is do we have a tubal reversal, or is there another option to do the tubal reversal in? And as we do this, again, feel free to ask questions. I'm not sure exactly how to answer those or how to see those, but we'll, if they pop up on the screen, I will try to answer them. Anyway, so the question comes up, which is the best way to go as far as should the tubal be reversed, or is there another alternative? So the way that we used to deal with somebody who wanted to have a child is we would do a tubal anastomosis, which is typically referred to as untying your tubes. It's really not as simple as untying your tubes. What's typically involved is a surgery where you have to remove the non-viable or dead part of the fallopian tube. Hopefully there is enough tube left over. Then you have to sew that fallopian tube back together. Traditionally that had been done in what's called an open surgery, where you would do an incision into the abdomen like for a cesarean section. You would then operate inside, so it's a full-blown operation. You would use some sort of a magnification process, typically a microscope, that's what I would use. And you would carefully sew the fallopian tube back together using very, very small stitches. So it was a fairly involved surgery and would take a fair amount of time to do. Recovery would be typically about 6 weeks. You'd be sort of back to work in a week or two, and then the total recovery period about 6 weeks. It would all depend on how big of an incision you would have to do. Before you would do such a surgery, you would make sure that there was a reasonable prognosis that it could work. You'd have to know what type of ligation was done, or how the tubes were tied initially. The best prognosis would be if a simple clip was put on the fallopian tube. If the tubes were burned in a large section, that would give you the worst prognosis. Sometimes you would have to do some sort of assessment of how much fallopian tube was left to see if there's even enough fallopian tube left to put together. And then you would do that surgery. The alternative to that is in vitro fertilization. In vitro fertilization would involve simply taking medications for about 10 to 14 days to stimulate eggs to grow, then retrieving those in a simple needle procedure that was under anesthesia, but it wasn't under general anesthesia, and you would not need to have any type of incision performed. You would remove the eggs, fertilize the eggs, grow them to a mature stage, and then at some point put those put those embryos back into the uterus to establish a pregnancy. So how do you decide which one of those to do? Typically what we would say is if somebody is very young and wants multiple children, then trying to put those fallopian tubes back together would probably be the best way to go. If somebody was older and they only wanted one more child, then you would lean towards doing in vitro fertilization. exactly how old is too old would vary amongst different providers and the patients. You know, certainly somebody who is approaching 40, the idea of repairing the tubes is not that great of idea, because the egg quality and number is already getting critical, and the time it takes to do the surgery, heal from the surgery, and then see if the surgery is going to work might very well use so much time that the person age would result in them not being able to get pregnant. But certainly if somebody is less than 35, that's something they might want to consider if they were willing to undergo another surgery. Nowadays, other things are coming into play that are making tubal reversal surgery less common. Probably the biggest thing is simply that in vitro fertilization is becoming much more successful. Success rates in someone with proven fertility, which would be somebody who had had a tubal ligation, easily exceed 50% in age groups up until, say, 37, 38 years of age. And so it becomes a very effective procedure. And then it comes down to a cost-benefit analysis, which costs more and which is going to give me the greatest chance of getting pregnant. So the cost of a tubal reversal varies a lot depending on the environment you're doing it in. Most of the time it's done in a regular main operating room, and the cost of the time in that room can be significant. So it's not uncommon for a tubal anastomosis surgery to be in the $7,000 plus range as far as cost. And so still that had a little bit of a benefit over in vitro fertilization, which in many settings might be in excess of $10,000. Since we launched our Gentle IVF program, many patients are choosing to move quickly and straight to an IVF procedure because the total cost, including medications, of a Gentle IVF cycle is going to be less than $7,000. It'll be around $6,750. So people are simply doing the math, realizing that in a Gentle IVF cycle is relatively simple to do. The success rates are projected to be quite high, and they don't have to undergo a big surgery. So that is becoming a significant choice. You can find out more about Gentle IVF on our website. Again, it's arizonafertility.com, and you'll see something that says our prices. You just click on that, and you'll find a discussion of optimal versus Gentle IVF. Click on Gentle IVF, and it gives you pretty much all of the details there that you'd want. Plus, I think last week we had a Gentle IVF discussion, and in previous weeks we've also had Facebook Lives discussions of Gentle IVF. So that's about it for today. I don't see any particular questions coming down the pike. Again, if you do have questions, you can simply contact us through the website, arizonafertility.com. There's a Contact Us tab. You click on that, ask your question. We get back to you. We also have something called Talk to a Doc Today, where if you want to just talk to me today for just ask some quick questions, you just contact us or call us at 602-343-2767. Say you want to talk to a doctor today, and we can certainly go over all of those things at that time. So that's about it. Hope that answers your questions about IVF versus untying your tubes, and be happy to answer any future questions directly if you'd like. Have a great evening.